Thank you, Supervisor Peskin. I'm very honored and humbled by that introduction. And I just want everyone on this call to know that Supervisor Peskin was a very early adapter of all things COVID. And in fact, we had many calls. He was actually the earliest supervisor who reached out to me directly, raising concern, the alarm, and has really been driving so much of this work in terms of the response that the city has had. And this is a DPH response, but with Mayor Breed's leadership, of course, it's a response of all city departments. And I also want to acknowledge law enforcement's role in this. It's been an incredible partnership. And also acknowledge Katie Tang, who we were lucky enough to have joined the department. Again, Supervisor Peskin was very supportive of that. And as our Director of Public and Governmental Affairs, she joins us tonight. So I think I'll just dive right into some data. For those of you who know me, I kind of focus on the data, and then we can have some time for discussion, and happy to answer questions and then follow up if we run out of time. Why don't we go to the next slide, please? So with regard to COVID-19 in San Francisco, we've diagnosed over 36,000 cases. Total deaths, unfortunately, we've had 536 deaths due to COVID-19. And I think at this point in the pandemic, most of us, perhaps all of us watching today, have lost somebody that we've loved, cared for, known, perhaps a family member, perhaps a friend due to COVID-19 across the nation. Thankfully, in San Francisco, while 536 deaths was far too many, we've had one of the lowest death rates in the country, and the lowest death rate on the mainland of any highly populated jurisdiction. So that's good, but again, we still have suffered greatly as a community. Our average number of cases confirmed daily is now down to 24, and these background in the darker blue, the graphs show the pandemic trajectory over the last 16 months now. So you can see in the background that very high peak where we were reporting hundreds of cases a day. We're down to 24 cases a day now. We're doing nearly 5,000 COVID-19 tests. And right now we have just 16 people in the hospital with COVID-19. I wish I could say that was 0, but 16, just to give you a perspective. In our winter surge, our peak, we had 256 people in the hospital. And that was in mid-January. So we've certainly come a long way, and we've beaten back 3 surges, and want to thank all of you for your support. San Franciscans have been incredible during this time in terms of adhering to public health guidelines, helping us follow the science, data, and facts. And I think most importantly, understanding that this is not just a public health pandemic. This is a pandemic that has social, economic, and cultural consequences, many of which I think we will deal with for the upcoming decades. Next slide. And again, this is showing our case rate since early on in the pandemic. And just to say that for those of you who'd like to delve deeper on these, all these slides this slide and others that look like it in this presentation are available on our San Francisco data tracker. So you can follow, and they're updated daily. Next slide. This is our number of hospitalizations. Again, you see that big peak in mid-January, and you see our other peaks in the first surge, what we call the summer surge, and then the winter surge. The dark blue lines are the number of patients in the ICU, intensive care unit. The lighter blue lines are the people in the medical surgical beds, the non-intensive care unit beds in the hospital. And then those yellow lines are the number of people who've been transferred from other places to San Francisco for care. And this represents our hospital systems across San Francisco, including Zuckerberg San Francisco Hospital, which, as you know, is part of the Public Health Department, and then our other key partners during this pandemic, including Kaiser, UCSF, Sutter, and Dignity Health. Next slide. And San Francisco is progressing through the state color tiers. You probably are all familiar with this color tiered system, which was adopted by the state. purple, red, orange, and yellow. We are in the moderate spread right now with regard to our statewide metrics and our ability to reopen. I'm really pleased that we will be moving to the yellow tier. We expect very soon this week if the data continue to hold up the way they are. So we've continued to make progress, but again, we've been very deliberate about our reopening and trying to get the balance right between getting vaccine into arms, reopening carefully and thoughtfully so we don't overshoot and have another surge or a significant increase in COVID-19 cases. Next slide. So we're not out of the woods. Immunity levels at the population level are insufficient to prevent spread without restrictions. And I think we've seen some of that nationally in situations like Michigan, what we're seeing now in the Northwest. We have higher COVID-19 vaccination rates than any of those jurisdictions right now, but we still need to be cautious. People under the age of 16 are not eligible for vaccine yet, but we just got some hopeful news this afternoon that we expect the FDA to authorize emergency use authorization for the Pfizer vaccine for people 12 to 15, perhaps as early as next week. Variants have emerged that are more contagious and may reinfect and could be more potentially fatal. So that's another challenge for us to face. And again, as I said, we need to balance vaccination with carefully reopening. But the bottom line, if there's anything that you take away from this talk or anything I can convince or help with here, get vaccinated, please. Get vaccinated, get your friends, get your family members vaccinated. It is our way out. These vaccines are simply outstanding. And as you'll see, the benefits of the vaccines far outweigh any risk at this time and are really remarkable. Miracle of science, the vaccines are just really a game changer for us. Next slide. So I did want to just mention variants because they've been in the news quite a bit. So it's important. Variants are a natural part of how viruses evolve. Viruses change rapidly as they reproduce. And a variant is a version of the virus that possesses mutations that differ from the parent virus, or what we call the wild type virus. Some variants emerge and then disappear. Most variants actually don't have an evolutionary advantage, but some do, and those that do become more common. Through genomic sequencing, we can identify variants that are concerning, and those require study and precautions. And unfortunately, due to the lack of investment in laboratory infrastructure across the country, we have not had a historically robust surveillance system. So at one point, fewer than 5% of COVID-19 samples were being tested for variants, and the CDC had very little capacity. So the country is behind in this, but in working with UCSF, we are quickly scaling up our system in San Francisco and across the region. And we become concerned about variants when there are reasons to become concerned in terms of the transmission, severity of treatment, or vaccine effectiveness. But I just want to say, from what we know right now, there is the vaccines are either known to be highly effective against many of the variants, including B.1.1.7. And right now, the consensus in the scientific community is the best way to protect against variants is to get vaccinated. Next slide. So in terms of, I just said this, the vaccination is key. And then also, if people are not vaccinated, and until we reach, in certain cases, a higher level of vaccination rates, we need to continue masking, particularly in large crowds, with large numbers of people who may not yet be vaccinated. Next slide. So the vaccines are very effective, and I think one of the key things is, the clinical trials showed really great results, but now we're seeing results from many other places that have several places that have had high vaccination rates, including the UK and Israel. and we see a population level effect. And you can just see this, for instance, in the United Kingdom, which was an early rollout of vaccine, high uptake of vaccine. Look at the cases since April. They have plummeted very, very quickly, and breakthrough infections are extremely rare. So while there's been a lot of the publicity about breakthrough infections, they are rare. The risk of death is substantially, is dramatically decreased, more than substantially decreased, and the risk of death is dramatically increased if people get the vaccine. Now, I will say here that the United Kingdom and Israel have been a real success story in terms of having high vaccine uptake and lowering the infection numbers. There are other places where that hasn't been seen. So Chile is an example. The consensus there, or the scientific input there, is that Chile opened too quickly in relationship to how quickly they were rolling a vaccine out. And there was a high preponderance of variants, and therefore Chile is still in pretty serious shape. But that really contrasts to the United Kingdom, which reopened slowly, is still reopening relatively slowly, and they got the pandemic under relatively good control, even with one of the most concerning variants, the B.1.1.7. And again, if you like to go into deeper depth, these maps are available on the New York Times website, which for the international and national data actually has a really good summary, and I find it a little more readable than some of our CDC graphics. Next slide. So I just wanted to take a moment and orient you to our vaccination approach in San Francisco. This is a very busy slide, but it's busy for a good reason, which is early on with Supervisor Peskin's support and his colleagues' support and Mayor Breed's leadership and other city departments working with the health department, including the Department of Emergency Management, and most importantly, community support and input. We built a ecosystem of vaccine delivery that has the capacity to deliver 20,000 vaccines a day. We have high volume sites. We have network sites. The San Francisco Health Network is the DPH, Department of Public Health Clinical Care Network. We have community clinics. We have neighborhood access sites, mobile units, and our pharmacy partners. So we really emphasized low barrier access to vaccines, that every door is the right door, that we were providing culturally appropriate materials for people to understand how, where, and when they could go to the vaccine, and really increasingly having a high touch, almost door-to-door approach as we continue to try to get our vaccine rates up in the city. So a busy slide, but it's because we've been busy doing the work, creating this ecosystem so that people have as much access, low barrier access to vaccine as possible. Next slide. So far, that effort has gone well. We have 72% of San Francisco residents have received at least one dose of the vaccine. That is substantially higher than the national and state average, 72%. And I would say among people 65 and older, people most vulnerable to COVID-19, we are at over 86% of people 65 and over have received a vaccine. And the reason that is so important is that in San Francisco, 86%, it's coincidentally the same percentage, 86% of our deaths due to COVID-19 have been among people 65 and over. So important progress there. We still have more to go, but I'm really pleased that we have such a high level of vaccination uptake in our city. Again, we need to focus on people who have hesitancy and also people who have lack of access to the vaccine. But we're, again, with our low barrier, every door is the right door approach, we will continue to make progress. Next slide. So just in terms of what you can do after you get vaccinated, you can actually see other people in small groups without a mask inside, which is great. I think we know that there have been pictures and lots of communication around grandparents finally being able to see their grandkids. That's great. For those of us who have been vaccinated, it's been wonderful to see friends in small private groups indoors without masking. That is consistent with CDC recommendations. We also, those of us who are vaccinated can refrain from quarantining and testing following a known exposure if we're asymptomatic. And I fully expect that more will come. There will be more and more reasons. But one of my friends said, the reason to get a vaccine is so you can hug up the people you love again. So there's a lot more information on vaccines and how to sign up for vaccines on our website. We have lots of access now. So compared to where we were just a few months ago, people are able to access vaccines. And again, we will bring vaccine through our mobile teams to places where there are numbers of people who have not been vaccinated yet. I will say that I have a clinic at next door shelter on Polk Street. When I saw patients there, I was able to talk to them and walk them right over to the mobile team that was there that day to get vaccinated. So that's the sort of low barrier access that we and our partners are continuing to support, so we get that vaccination rate even higher. So lots of website references here, and we can certainly also put that in the chat if people need that and click on. And I think also we will, of course, share this presentation so you'll have it as a reference. So I hope I didn't take up too much time talking or lecturing, but hopefully I can answer some questions. Thanks.
Yes, thank you. Thank you so much. Thank you. Thank you very much, Dr. Colfax. That was great. That was great. It's wonderful to see. It's wonderful to see those numbers coming down as fast and as impressively as they have. That's the combined effect and effort of a lot of people, not the least of which are people in the city who have taken the steps that help to make that happen. We have time for about 10 or 15 minutes worth of questions. Nick, what questions do we have?
All right, we've had a few come in. By the way, keep them coming. But first question for Dr. Colfax. CDC has said viral contagion by substance surfaces is almost impossible. What are your views on this, for instance, as it impacts reopening of schools and restaurants?
Yeah, so we'll continue to follow the CDC guidelines with regard to that. I do think, early on in the pandemic, we didn't have all the information about how this virus was spread. The vast majority of the spread is through respiratory droplets. So you get close to somebody who's infected. And I think one of the other things is, people can be very infectious even before they show symptoms. So they're asymptomatic, which is a key issue with this virus. So, unlike a lot of other viruses, people can spread before they even have symptoms. But to the point of the cleaning, we'll follow the CDC guidelines. I expect over time, the emphasis on cleaning as key will probably continue to be de-emphasized. We saw the CDC modify guidelines around disinfecting surfaces to saying, soap and water are adequate. And I think we'll continue to probably move in that direction. The caveat there, because I always have to have, is that, if there's a variant that somehow adapts to the situation, then we may have to scale that back up again. But right now, focus on what matters, which is, avoiding inhalation of airborne virus, particularly in crowded settings, and particularly in situations, hopefully you won't put yourself one in, but if people are not masked.
As a follow-up to that, Dr. Colfax, what do you think is the likelihood that we do develop a variant that isn't responsive to the current vaccines?
Well, it's certainly theoretically possible, but what I'm concerned about is the focus on that hypothetical is not is taking away from the importance of people getting vaccinated, right? And again, from what we know, and I talked to the scientists at UCSF on a regular basis and other infectious disease colleagues across the country, everybody is get vaccinated. Yes, there may be a theoretical risk of a variant emerging at some point. And, in other places worldwide, we're seeing the virus really reproduce at very rapid rates. But if that were to happen, I think especially with the vaccines that we have, there would be a likelihood of modifying the vaccine and then adopting the vaccine to that variant, just like we do with the flu vaccine every year. But we got to put the vaccine into arms. That's the best way to get these variants under control. The California variants, which some of you may have heard of, that appears to be controlled by the vaccine. The B.1.1.7 appears as well, so that's really good news. And some of the other variants, there's been a lot of reports, the vaccine are decreased effectiveness, but on the clinical side, there's really not a lot, there's very little evidence that they're going to break through in a significant way.
Thanks for that. So do you have any visibility into how vaccination outreach is going for our neighbors experiencing homelessness?
Yes, so we've been working very hard. So we have a large homeless medicine team that has been working very hard with key stakeholders, in many coalitions, community partners, and the Homelessness and Supportive Housing Department. We've again taken an all of the above approach with regard to vaccinating the homeless population. As I said in my clinic, where that is at a homeless shelter, we have mobile teams going out. That wasn't a one-time thing. Mobile teams are going out to shelters, and we're accessing hundreds of people experiencing homelessness so that they can get vaccinated. So our mobile teams are very much focused on the homeless population, and meals have been going into arms pretty efficiently with regard to that, including, by the way, with the Johnson & Johnson vaccine. If people choose to have that, that's the one and done vaccine. So people can also have, we've been using the Moderna and Pfizer vaccine as well, but I think that there are certain advantages that people like about Johnson & Johnson. Of course, we provide them the full informed consent about the side effects of Johnson & Johnson, which, by the way, are rare. Just to put that in perspective, the clotting disorder that is associated with Johnson & Johnson, the risk of that overall was 2 in a million. For women 18 to 49, the risk is 7 in a million. If you get COVID-19 in this country, the risk of dying is 1 in 68. And in this country is 1 in 56 in this country. And in San Francisco, if you get COVID-19, it's still 1 in 68. So just the risk of Johnson & Johnson associated effects are far, far lower than dying of COVID-19.
Yeah, you see that. I think a lot of people blow this out of proportion or aren't putting it in context, the actual odds. And yeah, I think that's an important point.
I think it's partly because, unfortunately, with 500,000 Americans dead, it's such an abstract situation, right? Like many of us, it's hard for us to picture those people. You can picture or think of 6 people that the first 6, the 6 that were first reported with a clotting disorder. That's a very tangible, qualitative. I think it's our human nature and emotional response to be able to think about that, and that becomes more fearful than the 500,000, which is at this point, unfortunately, such a massive number. So anyway.
Yeah. There's another question a little bit along similar lines as the previous question. So San Francisco seems to have done an excellent job managing COVID, but during the past 18 months, we have lost so many people to another pandemic and public health crisis, which of course is fentanyl. How did shelter-in-place hotels contribute to or mitigate these deaths? And what is your department doing to get these under control?
Yeah, I really appreciate that question. And just to emphasize, and I'm happy to come back and talk more about the behavioral health response, because the fentanyl crisis has been huge, and over 700 people died of fentanyl overdoses last year. I think there are a combination of factors that have driven the overdose rates up. I mean, obviously fentanyl, right, which is much more potent than heroin, you're much more likely to overdose and die from fentanyl. Then combined with the pandemic, which increased isolation because of our shelter in place, our services were not as expansive as they otherwise would have been. We did place thousands of vulnerable homeless people in shelter in place hotels. When we did that, we had a very strong wraparound approach. So it wasn't, here's a hotel room, hope you do okay during the pandemic. We have behavioral health specialists working in those hotels. There were a number of overdose reversals that happened there. And at the same time, people weren't congregating. And we know that one of the predictors of a fatal overdose is if people use alone. We have distributed thousands and thousands of overdose reversal kits, so saved hundreds and hundreds of people from dying from fentanyl because of that approach. We're also expanding now our efforts to have places for people to go to sober up if they do use. So a sobering center is in the works. That was delayed due to COVID-19. We're also investing through Mental Health SF and a number of treatment beds so we can get closer to the San Francisco model of treatment on demand. So when people are ready to go into treatment, I mean, I will just say the bureaucracy for getting into treatment, sometimes it's like going to the DMV. It can be really challenging, and that's not a user-centered friendly model, and we're working to change that. And we've made changes in leadership to transform our system. We've hired a new behavioral health director, Dr. Hillary Cunnins, who's 4 weeks on the job and was deputy health commissioner at in New York City. So, and did a great job in focusing on fentanyl and overdose prevention. So I think we're on the right track. We still have a ways to go, but we're going to be hopefully making some strong progress there, especially now that we can focus more on that with the COVID pandemic under better control. And happy to come back. That's a whole nother sort of area, but happy to come back and talk more about that.
Thank you. So what do you think? This is, given the trajectory of vaccination in San Francisco, is there indication that our city will be moving into the green tier, and along what time frame would you say?
So yeah, good question. So the governor has announced that things will go to, for practical, I'll say back to normal. I don't know if that's, I'm not quoting the governor. So, but basically June 15th, most restrictions will probably be lifted, especially if the state continues to be in the great shape it's in. I think if we get up to, you know, an 85% vaccination rate, our chances of going back to a much more normal situation is very high. Now, I don't know if we'll be, you know, able to go back to hundreds of people congregating without masks in close quarters, regardless of vaccination status. I think that that's going to be maybe some way off, but we're progressing pretty quickly at this point. It's really trying to get that balance right, and hoping that we don't overshoot in reopening too quickly, but also acknowledging the socioeconomic and mental health consequences of having been in this situation so long. So I'm cautiously optimistic with the progress we've made. I'm actually more concerned right now about the lack of the lower vaccination rates in the rest of the country, because the question of whether the country is ever going to get close even to 75% vaccination. I mean, we have a few more percentages to go. As you know, we even though we do it the San Francisco way, the virus will continue to grow across the country if we don't get higher vaccination rates in other parts of the state and in the country, not to mention internationally. So that's my concern. Eventually that could catch up with San Francisco, but right now we're continuing to move in the right direction.
So we've got another question here, sort of talking about indoor dining as well, and just the safety. And so I think it's, what could you share? Well, here, I'll read it out. Is it really safe to be opening up indoor dining and bars with the presence of these variants? What about the study that showed 6 feet was not enough distance from someone with COVID-19?
Yeah, I mean, I think the answer, yes. So there's a balance. And, I guess my answer to that is if you're concerned about that, get vaccinated, get fully vaccinated. It's it's magnitude safer for you to go if you want to engage in those activities if you're vaccinated. And then, the safety protocols that we put into place mitigate that risk substantially with compliance. And, I would also say the San Francisco business owners, including the Golden Gate Restaurant Association, they've been incredibly collaborative on this working together. There's no, if you're not vaccinated, there's no such thing as, an infinitesimal risk in this situation. The level of virus is low. Everyone should do their part by getting vaccinated. And then I think we'll be in a much better place. I think at this point, the question would be more a year from now, as we are vaccinated, whether or not we need a booster, I think is still is still speculative, but is this going to be more like, we behave as though there's a year-long flu season, right? And manage that accordingly.
So, Dr. Colfax, I know that you're on a short fuse tonight. You have a drop dead date pretty soon here. So can we take maybe just one, maybe two more questions?
Don't say drop dead, Mr. President.
Yes.
All right, all right, we got two questions here. One of them, so, of course, what's very top of mind for you right now, Dr. Colfax, is addressing COVID. But there's also, a fast-growing mental health challenge for a lot of, folks of all ages, and in many ways very much due to the pandemic. How is this issue being addressed by your department? What are your thoughts on that?
Yeah, so I think that's a really key point. And what we're doing is with mental health SF. So mental health SF is the large investment led by the mayor and the board to increase our behavioral health services for people, particularly people on the street. But we're also now focusing on a behavioral health recovery plan for COVID-19, because this is going to take, just the fact, kids who have been out of school for so long, the learning gap, the behavioral health issues that come with that. So we're working both within the health department and other healthcare system partners to emphasize the need for people to get the help that they deserve if they're dealing with the effects of COVID-19. And then beyond COVID-19, I think with the investments that Mental Health SF is going to afford us, we will build out a much more robust system of behavioral health care. And when I talked about the fentanyl and overdose, right, so many people who have substance abuse issues also have mental health issues. So we don't necessarily separate the two in our thinking about this. We need to build a system similar to what we did with vaccines, where every door is the right door, low barrier care. Let's get away from this, DMV model of fill out these 15 forms and show up at your clinic appointment in 3 days and hope you don't use fentanyl before that. And I don't mean to be dismissive of it, but I do think we need to push through the bureaucracy to ensure that we're meeting people where they are, and then build out a system that builds on our strengths as a public health system in terms of a harm reduction model, but then also recognize that we have to change some things as we've done them. That there are places, there is room for people. We need to make room for people to go into spaces where no drug use is tolerated. And then I think we have to have a conversation, as a ongoing conversation as a city and as a community, for people with mental health illnesses. If people are not a harm to themselves or others, direct harm to themselves or others, but don't want treatment, we have very few tools at our disposal right now. And especially as law enforcement realizes that law enforcement is not the answer to this issue. Well, how do we approach people who refuse treatment but are not, there are no current tools, state laws or other, to mandate that they go into treatment unless they are at the most severe point of either hurting themselves or hurting others. And I think that's a key question. That's a longer discussion, but that's something that we need to figure out as a society as a whole in San Francisco and in the health department.
Yeah, I know that's just along that line. There's, you think of, unsheltered populations that have developed these challenges. I know, I'm involved in my elementary and high school. There are so many kids. I am shocked at the number of children that have developed illnesses, because they just can't learn on Zoom. It's frustrating. Yeah. They've got a bad internet connection. There's that population as well that really needs help.
Absolutely. And we are embedded we have relationships with the Unified School District also in terms of behavioral health support. And we've been working very hard since April of last year with the school district to encourage them to reopen schools. We have been very clear that schools can be reopened safely. Private schools have done it, and we've made great progress recently with the school district in supporting that effort.
So the final question we have for you tonight, Dr. Colfax, what can the public, county government, and state governments do to respectively honor the public health heroes of California?
get vaccinated. Seriously. I mean, if you want to help the front line, the people on the front lines who put their lives at risk for over a year and a half, people, you know, the nurses working in the San Francisco General Emergency Room, that behavioral health worker who was working at our isolation and quarantine hotel rooms, putting themselves at risk with people known to be infected who also had behavioral health issues. If you want to honor our sheriffs, our police who are on the front lines, our fire people, get vaccinated. I think that's by far the most important thing you can do, and encourage all your friends to do so as well. Really, nothing else compares.
Thank you very much, Dr. Colfax.
Thank you so much. Thank you so much, Dr. Colfax. And I want to make it entirely clear that you have a hard stop this evening and not a drop dead time.
Well, thank you. And just thank you for your support. And I look forward to continuing to meet with you, or my team meeting with you, to hear your concerns. And again, I just want to thank everybody. It's been a year, but you know, public health can bring out the messages and ask people or tell people you know, what to do, but it really takes people to pull together to make it work. And want to thank all of you for your support. And we will get through this together. It's been incredibly challenging year, and we've had, I'm sure each of us has had our share of concerns and perhaps tragedy, but thank you for your support, and cautiously optimistic. We are definitely moving in the right direction right now. So thank you.
And President Hayes, if you will indulge me, I just wanted to use this opportunity, which I rarely do, to personally and publicly thank Dr. Colfax and his frontline responders. You heard him choke up earlier when he was talking about hugging loved ones. Many of us early on in the pandemic went through that. I cried a lot early on, but the response from the Department of Public Health, particularly on something that Nick and the questions didn't raise around equity, has been superlative. When it came to making sure that underserved communities that had language access and other cultural barriers to getting, you know, what do you say, Grant? Vaccinate. When they couldn't come to you, you went to them. I really profoundly want to thank you. I will not start crying. I will not choke up. But thank you, Dr. Colfax, and to your leadership, and to Dr. Phillip, and most importantly to the nurses and doctors who are doing this every day. You've been superlative, sir.
Thank you, Supervisor. I appreciate it. Thank you.